healthcare assistant is a robust automation software package aiming to simplify the daily processes and tasks agencies encounter during their day-to-day operation. The software is built upon an open architecture that lends itself to a seamless integration with many third-party products. This provides agencies the flexibility to keep some of their existing products in place or choose from several partner products, including web or laptop-based point-of-care tools, QA tools for OBQI, as well as interfaces with several medical supply companies. Each module within the healthcare assistant work together harmoniously, just as each department interacts with each other in a home health agency. Proper implementation of the healthcare assistant will help an agency achieve efficient use and increase productivity while providing a patient management framework that is scalable for growth for both small to medium-sized agencies as well as larger enterprises with multiple branches. The healthcare assistant makes patient management easy to even the most novice of users with the implementation of different methods aimed at simplifying the process of sorting and categorizing patients. The software allows users to know the status of the patient by using a color-coded system in the patient list. This list also has the ability to be filtered by customized patient demographics that are user-defined through the Categories module. This allows for unique patient categorization, mimicking your agency's existing procedures, while adding the benefit of flexibility not found in most software applications. The workflow of the healthcare assistant mirrors that of a typical patient cycle to ensure accurate data, input, and processing while maintaining compliance with Medicare standards. Within the patient file, users will be working in a linear fashion, creating a user-friendly data entry system. The patient record is flexible enough that efficient work is possible even if one person or multiple departments are accessing the patient record at different times to perform their assigned tasks. Verifying the patient's home care eligibility status has never been easier than with the Eligibility Assistant by Healthcare Synergy. This built-in functionality allows you to check a patient's eligibility status by connecting you to the CMS Common Working File without ever having to close or minimize the Healthcare Assistant application. Just press the Check Eligibility button as you enter the patient's insurance data and all other information, including whether or not the patient has Medicare as a secondary payer. All are returned to you instantaneously. OASIS data can be inputted and processed in more convenient ways than traditional methods. An HHRG calculator quickly allows you to view financial impact of a patient without having to wait for the entire OASIS document to be entered. The software also offers clinical and coding audits in addition to the standard OASIS grouper validation check, a very useful tool for even the keenest of QA staff members. There are several reports to assist in managing OASIS data. These reports include the OASIS status list, which can be used as a tracking tool to properly monitor compliance with OASIS regulations, as well as the OASIS therapy utilization report, which provides information that may help to determine if an episode is on track with the stated utilization of therapy visits. The healthcare assistant also has the ability to create a batch file to fulfill your OASIS electronic submission needs, thus eliminating the necessity of the state-provided Haven software. The software has multiple methods that can be utilized to automate the creation of the patient's plan of care. These consist of automatically populating orders and safety measures and using the diagnosis library templates to populate such items as orders, goals, medications, safety measures, nutrition, and supplies. Also, treatment codes allow the creation of orders and goals that can be added using the Windows drag and drop functionality. Lastly, OASIS templates give users the option to insert orders and goals based on responses to MOO items. These different methods are used to decrease the amount of time necessary in creating the plan of care while ensuring that the data entered is specific to a particular need or order as detailed by the agency policies and procedures. The plan of care can also be monitored using the Plan of Treatment Tracking Report as a tool to view documents that need a physician's review and signature. When it comes to scheduling, the healthcare assistant has multiple methods of meeting the needs when it comes to scheduling staff. It features the ability to schedule visits in a calendar view on a per-patient or per-caregiver basis. All visits that are scheduled run through a visit frequency check, ensuring that all visits scheduled are performed and in compliance with what was signed off in the plan of care. Appointment lists and calendars are available for printing, and weekly caregiver schedules can be produced and distributed to the appropriate field staff members. Furthermore, the healthcare assistant has the capability to create and print caregiver route sheets, adding to the amount of varied methods used to complete the task of scheduling and tracking visits. The Communications module allows for the ease of tracking any type of documents or communications as they relate to the patients you care for. It also has the flexibility and openness to meet an agency's ever-changing need, making the healthcare assistant a comprehensive electronic medical record maintenance solution. Communication notes can be entered and linked to the patient's current episode or admission for further sorting. Users have the ability to print out communication notes and also have the option to require signatures by certain staff members to make it a part of the patient's charts. In addition, different templates can be created to mirror the different types of communication forms that go throughout your agency, whether it be doctor's orders, visit frequency changes, 60-day summaries, or more. The template option allows your agency to digitize much of its paper-based processes. Furthermore, the communication module allows for attachments of any kind to be linked to the patient record. Emails regarding the patient? Attach them to a communication note. Pictures from a digital camera documenting a patient's wound? Add it to the communication note as well. The possibilities of what communication notes can do are endless. With the added benefit that these communication notes provide, they can be shared throughout the agency with anyone who has access to the patient's file. This is the true definition of centralized patient information and electronic medical records. Billing patient insurances couldn't be easier than with the healthcare assistant. Beginning with Medicare PPS patients, the program automatically generates both your wrap and final claim based on certain events that occur within the patient's cycle. This ensures that once proper steps have been achieved, your initial and final claim are automatically generated, taking the guessing work out of having to figure out which claims your patients are able to be billed for. For private duty and Medicaid patients, you have the ability to create claims on an individual basis, or you can create claims for multiple patients, all based on a date filter provided by the user. The healthcare assistant has the ability to create an electronic medical claim submission file that can be submitted to all of Medicare regional home health intermediaries, as well as a growing list of state Medicaid programs and private insurances. Submitting batch claims has never been easier and reduces the need of utilizing the direct data entry approach of claim submission. This feature allows the agency to receive on-time payment and focuses the attention of the biller only on claims needing corrections. Along with this, the healthcare assistant can process electronic remittance advices, further automating the reconciliation of insurance payments. Using the ERA saves time and instantly allows the user to easily spot outstanding claims without having to sort through piles of paperwork. The healthcare assistant also meets HR needs by being able to track caregiver licenses and perform caregiver payroll functions. Within each caregiver entry, the healthcare assistant is able to track a list of custom-defined licenses or certifications each of your caregivers possess. This can contain information about their nursing licenses, CPR certifications, driver's license, and expiration dates. The list can go on. Performing payroll duties in the healthcare assistant can be done easily by assigning different per-visit rates to each caregiver. The payroll module then processes all of this information, and based on your criteria, you can print out a payroll proof list for your payroll staff or export this content into a .csv file, which can then be exported to Paychex, ADP, or any payroll service which utilizes the .csv file format. Meet HIPAA security demands by restricting access to confidential patient information with the healthcare assistant's user file. This module allows an administrator to be able to create individual or group user accounts, as well as define user roles for different departments within an agency. The user file also has the capability of being able to set password expiration timeframes and reminders when users log in to further increase the security of the agency's data. In addition to meeting HIPAA security, the Sybase SQL Anywhere service, which is the database engine in which the healthcare assistant resides on, is the same database management system that is currently in use by the U.S. Department of Defense. Not only is the Sybase SQL Anywhere service more robust and multifaceted in comparison to its competitors, but it has been known and awarded for its extreme high level of security and database encryption, something very important to home care agencies of all sizes. All of this comes packaged with the healthcare assistant in addition to our unparalleled customer support and education possibilities. Our highly trained customer support is always more than willing to help answer your questions or resolve your problems. They are available for your convenience Monday through Friday from 6 a.m. to 5 p.m. Pacific Standard Time. Healthcare Synergy also offers many different methods of training and education with bi-weekly online training sessions or an on-demand e-learning facility, complete with classroom-style learning environments. Also, Healthcare Synergy holds many regional users meetings where healthcare assistant users can come together to stay up to date with the software and attend seminars featuring some of the finest names in the home care business.